Hi, my name is Melissa Adams Van Houten, and I am here at Digestive Disease Week 2019 with Dr. Grace Elta, the DDW Council Chair. Thank you, Dr. Elta, for agreeing to speak with us.
Sure.
This is my first year at DDW, and a lot of people in my community don't know anything really about the conference. And I was hoping that for those who are watching in my community, you could give us some basics about the conference, who attends it, and what
Sure.
are some of the highlights.
Sure. So DDW stands for Digestive Disease Week. It used to be years ago, a whole week long. Now it's shortened down to really 4 days, 4.5 days. But it's still the largest medical international meeting in the world that's dedicated to the field of gastroenterology, hepatology, endoscopy. We usually have around 14,000 to 15,000 attendees. About half of them are internationals, the other half are from the U.S. The largest number are gastroenterologists like myself. But we have hepatologists, we have some surgeons, and we have a few basic science researchers who do research in the field of digestive diseases attend.
Wonderful. And can you tell us a little bit about your background and why you got involved with this?
Sure. So I have been on the faculty at the University of Michigan for 37 years. Actually, just recently retired a month ago. So I'm professor emeritus now, but have obviously been a practicing gastroenterologist and endoscopist. My subspecialty has been interventional endoscopy, where we do advanced endoscopic techniques. But the whole field of gastroenterology, which includes gastroparesis and motility disorders or muscle disorders of the gut. And so that's my interest in terms of how I got to be DDW chair. Digestive Disease Week is an unusual meeting in that it actually is a combination of 4 professional societies. Most medical meetings are generally one professional society, like the American College of Cardiology will have one meeting. This is 4 different professional societies. And so we have a council of the 4 society leaders, and I actually chair that council for the last 5 years. I have 1 more year. So that's how my involvement is. How did I get to be council chair? Well, I was heavily involved with one of those societies, the Endoscopy Society. I was president of that at one time, and I certainly was program planning for Digestive Disease Week back in the early 2000s for the ASGE, which is the Endoscopy Society. So that's how I got involved with Digestive Disease Week.
Wonderful. And you are celebrating the 50th anniversary
Yes.
of DDW.
So
what do you think that says about the significance of the event?
Yeah, so 50 years ago, the 4 societies got together and said, let's make an even better annual meeting. Professional societies often have an annual meeting. Make an even better one by sort of melding these 4 societies together and bringing different areas of expertise that are related, like the surgeons, for instance. And so they did, and it's gone strong for 50 years. It continues to do very well. So, as I said, it is the largest GI meeting in the world, although there are many other ones now, so we have a lot of competition.
Wonderful. And this year you have invited some patients like me to attend. Why is that important, do you think?
Our focus in medicine is always the patient. They're the most important part of medicine in general, regardless of the field. And so we like to hear from patients, hear what we're doing right, hear what we're doing wrong. It's not all science. A lot of it is, the human side of things. And we're all very aware of that as physicians, but we like to remind ourselves of that.
Wonderful. And what is your hope for the future of this conference?
I hope it continues another 50 years. I think it will. I don't think there's any reason to expect it won't. Conferences like this, about half of it will be what I call didactic sessions, where you have lectures in various formats, sometimes small meet the professor type sessions, some very large lecture room sessions. And then the other half is research. So they're abstracts where the latest research is presented. And the research driven part of it is, of course, the cutting edge of our field. Research, we'll have, I think at this meeting, I'll probably quote the wrong number, but it'll be thousands of abstracts that are presented. So that's the thousands of pieces of research from around the world in the world of digestive diseases were presented at this meeting. And that research is what takes us forward. We really have made tremendous changes. I've been practicing long enough that I've seen so many changes in the field. So many new medicines, so many new diagnoses that we didn't even know existed back when I was a trainee. It's very exciting, and that type of excitement occurs at meetings like this.
That is very exciting. And is there anything else you'd like to say to my gastroparesis community who is watching out there?
Gastroparesis is a very frustrating diagnosis because oftentimes we don't know the cause, or even when we do know the cause, for instance in diabetics, we don't have many good treatments, so that makes it very frustrating. We have, as many of you know, really very few medicines that don't have bad side effects, and even the ones we do have aren't very effective. So it's very frustrating, and yet it causes significant symptoms and disability in our patients. So it's one of those diseases we need more research on, and we need better treatments. And these are the kind of meetings that occurs at. Although it's small steps, it doesn't happen in one big, like, oh, we fixed this one. But even small steps to have better treatments would be a tremendous boon to a disease like gastroparesis.
Absolutely. We will take those small steps.
Absolutely. I understand that. I mean, as physicians, we see how much patients suffer, and it is heartbreaking when you have nothing to offer. It's frustrating for us, too. It's frustrating for the patient, but it's frustrating for the physician because they're like, oh, we don't really have anything we can offer them. And that's so frustrating. So that's why the research side of this is so important.
Well, we appreciate what you're doing here, and I really appreciate you taking your time out of your no doubt busy schedule to talk to us for a few minutes.
Sure. Okay. Thank you.
Thank you
for
so
meeting me.
much.
Okay.